It was pretty much a shock when I first found out.
It's just the shock of everything all at once, because mine whirlwind really quickly.
But I didn't expect it. I had no symptoms of anything, and yet was diagnosed with inoperable stage 4 colorectal cancer.
I was diagnosed at 49, 2010. Primary site is colorectal cancer with metastasis to the liver and lung.
I'm a medical oncologist. I see patients with cancer. We look at to see what their options are with treatment. Take colon cancer. Even 1995, we had one drug. Today we have 9 or 10 drugs that work in colon cancer. We have different surgical techniques. We go after the cancer in many different ways. We try to maximize their care by giving them the best chances of either being cured or living longer and maintaining their quality of life.
I started out with a clinical trial, then had the surgery, then was on another regimen, chemo regimen.
They hit me with the entire arsenal of their known chemo drugs for colorectal cancer. I've also had the seer spheres put into my liver, which was brought to my attention through the oncologist.
I heard about seer spheres really from my oncologist. That's when I spoke with the interventional radiologist, and we weighed all the pros and cons.
So interventional oncology is a kind of a newer specialty involving basically minimally invasive procedures. Seer spheres are a specific type of therapy that we perform. Beads that contain high doses of radiation, and they're administered through the arteries into the patient, into the patient's tumor.
The mapping of the liver comes first to see if you're a candidate for it. And then a couple weeks later, you go in for your seer spheres. And basically, it's pretty much like the mapping. You don't feel anything. It was wonderful.
The benefits of local therapy are that you don't get the systemic side effects, throughout the body.
I had no side effects whatsoever.
I had really no side effect.
No pain, no discomfort whatsoever.
When I think about the amount of time related to the chemo, sitting in a chair every 2 weeks.
The procedure in and out, outpatient therapy, you're in for a day and you go home. If everything could be delivered that easily, I'd go for that route.
It was really nothing to be afraid of or be apprehensive about. It was simple.
So in the right patient setting, it's definitely a very powerful tool. It's been shown to increase life expectancy and also decrease time to progression of disease.
In 6 weeks, everything was gone.
And they were very successful. I would do it again.
Without question, there's a benefit to using seer spheres.
An experience that I would highly recommend.
I would absolutely suggest the seer spheres.
Yes to hope.
Say yes to hope.
I say yes to hope.